Did you know that every single day more than 2,000 Nigerian children die? Like, just like that, from things that, and they're dying from causes that we can easily prevent. It's actually staggering. And my question is, why is this still happening? The statistics are alarming, right? Someone might say 2,000 children a day. That's not that high. That's actually very, very high. Nigeria is Africa's largest economy, but at the same time, we're right now the global epicenter for child mortality. Like, we're actually losing our children to things that are fully, and I say fully, preventable deaths. We're talking about pneumonia, we're talking about diarrhea, we're talking about malaria. Every single one of these diseases is preventable with access to proper medicine, access to clean water, and access to proper healthcare. A lot of the children, they're born into homes where the mother doesn't have access to adequate prenatal care. So already when they're born, their life is already at risk. They also are not given the opportunity to develop properly. They don't have the nutrients to actually develop well. Like, scientifically, their brains do not develop properly because they don't have access to proper nutrition and proper healthcare when they're born. So they're already born at a disadvantage. I'm not talking about like diagnosed developmental delays. I'm talking about the subtle ones, the subtleties, and the fact that the brain doesn't get enough nutrients. A child grows up and their intelligence level is just not where it's supposed to be. And I'm also not talking about IQ. Our healthcare system is very underfunded. And I'm also not talking about IQ. I'm talking about the early years of a child, and the early developmental stages are so crucial to making sure that a child is properly nourished. And when a child is malnourished, it doesn't just affect their physical, it also affects the internal and their development of their brain. That's what I'm talking about. Our healthcare system is underfunded, and I'll get to that later. A lot of the facilities in the rural areas, they're either non-existent or they are just useless. Mothers are giving birth without skilled healthcare professionals, and we know why, because our healthcare professionals are depleting by the day, because this country does not reward healthcare professionals for their years of study. What they're paid is peanuts. So a lot of them have chosen to find other shores that are going to reward them accordingly to their profession. And I cannot blame them. In addition to that, a lot of these healthcare facilities, they lack good supplies. They lack basic supplies. They lack power, right? Our children are dying because of impunity, because of mismanagement. That's why they're dying. So let's talk about what's been done. What is being done to combat the fact that our child mortality rates are just too high. UNICEF, World Health Organization, they have multiple programs. The WHO has a program called Saving 1 Million Lives. This one is aimed at particularly at maternal and child healthcare services. There's a lot of vaccination and immunization strategies that are around. We all know that Bill Gates and the Bill and Melinda Gates Foundation, they have been really instrumental. They were pushing to make sure that people are vaccinated properly and people have access to the proper healthcare they need. T.Y. Danjuma Foundation, in 2021, they committed $5 million towards women and children's health programs. In 2018, Nigeria itself committed to invest $150 million in women and children's health clinics. In the Nigerian budget in 2023, a significant amount was allocated to maternal health care and also child mortality initiatives. Millions. In addition, the Federal Ministry of Health, they've outlined a 4-point agenda, and it's aimed at reversing the alarming rates of maternal deaths. The agenda is supposed to improve governance. It's supposed to help population understand exactly what's happening with our health. It's supposed to also provide health security. The ministry is supposed to also focus on increasing the capacity of our healthcare workers and making sure that our healthcare workers, in 15 years, we're not going to say we don't have any doctors in the country, because if we're not careful, we're going to get there. USAID also provided support towards this initiative. So a lot of initiatives have been created towards addressing child mortality and also maternal health as well. But something is missing. There's a gap because the rates are not falling. And I think what they don't understand is that in rural areas, there's a massive lack of trained healthcare professional. In addition, when there's poverty in the land and when things are getting more expensive, people are going to prioritize what it is. It's accommodation, food, and transport. Those are like the 3 priorities that people will hold on to. Why? Because accommodation, you have to have somewhere to sleep. Food, you have to eat to survive. And transportation, because transportation gives you the ability to get to somewhere to go and make money, right? So those are the things that people are going to prioritize. And we all know that between the two, mainly food, transportation, those have gotten really, really expensive. But we're talking about, so in rural areas where, they don't have things like antibiotics, they don't have things like you don't have the basics, they're not going to go above and beyond to go and look for these things. We need a really comprehensive approach in how we're going to address this child mortality issue. What this means is that we need proper spending of all the funds that have been committed towards this issue. We don't actually need more funding. Because I looked through the budget and there's money there. Money has been allocated towards this. Even though personally, I think that there can be more money. There can be more allocation towards it. Because the budget has about 5 or 6 line items. The budget has quite a few line items that are dedicated towards maternal health and children, right? But there could be more because the budget, guys, I went through so many line items. There's so many things. What we need to do is expand access to healthcare in rural areas, making sure that health workers are also incentivized to go and work in rural areas. So a simple example would just be that people who work in rural areas, they have some sort of additional stipend. I'll give you an example. If you're posted to Nigeria, if you work in an international company, a lot of international companies do this, and you're posted to work in Nigeria, right? They call it a hardship allowance. Why? Because Nigeria is not seen as a easy place to live. So the international companies will give their expats a hardship allowance to incentivize them to go and live and work in Nigeria. The same thing should be adopted. They need to give an incentive for people to go and live and work in rural areas if they have not done so already. But the problem is in rural areas, there are not enough healthcare, there are not enough health workers. And you're asking someone who's had a child who has so many other things to worry about. How far are they going to travel to go and meet a doctor? There has to be local clinics within the vicinities of each community. Our vaccination rates need to be higher. We need to pick back up sanitation because we already heard that cholera had come back. That's a sign of poor sanitation. These are the things that need to be done. And then finally, we just need the Ministry of Health. They need to make sure that they're pushing hard. We can't be losing 2,000 children every day. It's ungodly. There's no other way to say it. It's actually ungodly and it's disappointing and it's a shame. These are preventable causes. These are basic things, basic changes that can happen. I hope to see a change. I hope that we understand how important this is and how much we need to tackle it. Because with the way things are going, if we're not careful, it's going to just increase, which absolutely breaks my heart. All right, guys, let me know your thoughts on this. Make sure you comment, subscribe, like. I'll see you guys.